Joining us live now is Dr. Elizabeth Thomas. She's a pediatrician in Texas. Doctor, thanks for your time tonight. We appreciate it. It is concerning to hear this news about kids, multiple reports now about more infection and hospitalization amongst children in the country. Hard-hit state of Arkansas, doctor there gave an interview and said, we're seeing a real surge with the Delta variant that we did not see previously. This is the worst that we've seen it for kids. Absolutely. How concerned should parents be?
Yes, we are seeing a rise in Texas as well, especially in the two major hospitals here in children's hospitals. We are seeing a rise, and we are seeing cases daily, positive COVID cases. So there are cases going up, and a lot of it is because we are gathering in larger groups, going out more and traveling. So we are seeing that rise, and we do want parents to be reassured that they can do a lot in helping to decrease that. And I know that there are a lot of concerns, especially as parents are preparing for their kids to return to school.
And are we seeing this increase amongst kids because, as was reported also today, Delta appears simply to cause more severe infections than other strains?
There are still studies that are going on to determine why we are seeing more of these cases and if it is actually the Delta variant. But what we know so far is, especially in large group settings, we are seeing kids coming out of that positive for it. But we do want to reassure those parents that we are doing everything we can to limit their risk, especially as school starts again in the fall.
And speaking of schools, obviously some big guidance from the CDC this week. They're now recommending universal mask wearing in schools. Everybody, vaccinated or unvaccinated, mask up when the school year begins. Do you agree with that recommendation?
I do, and that is because masks have been proven to be effective against the transmission of COVID-19 along with other respiratory illnesses. And also by wearing your mask, you are protecting those that are not eligible for the vaccine. At this point, only those children that are 12 years and older are eligible for the vaccine. So what's happening is that kids are around children that are younger that are not vaccinated. And so by wearing the mask, we're actually protecting those kids and we're reducing transmission. And also it's a large burden on the schools to monitor those kids that are, whether they're vaccinated or not. And so by offering this universal masking, we're working as hard as we can to protect those kids to go back to school, because we have seen a lot of mental health effect on kids when they could not return back to school. So we want to encourage in-person school. We want to encourage universal masking, and of course vaccines for those that are eligible.
And you can tell in that last report, and just from what's been reported the last few days, obviously masks still a highly contentious issue in this country. In some states, it's illegal to impose any kind of mask mandate. What would you expect from schools and school systems that do not implement a mask mandate come next month or September?
Yes, we're absolutely encouraging the schools to encourage the kids to wear the masks. Now, if there are schools that are not following these recommendations, what our concern is that we are going to see more cases of children getting the virus itself and transmitting it to other children, especially those that have medical complex issues. We have a little bit of concern for those kids, especially kids that are not eligible to be vaccinated. So the concern is, if the masks aren't there to help protect those other children, we are going to see a rise in these COVID cases. Along with the colder weather, which is a nasty mix. Real quick, just a few seconds left. For those of us who have kids under 2, what should we as parents be doing, because they're not old enough yet to wear a mask? That's right. So those children that are under the age of 2, we want to make sure that we're keeping them close, making sure we're sanitizing those hands, keeping them away from big, large groups. And, you know, you want to definitely decrease your risk, especially as, like you said, fall and winter is coming and we're seeing those respiratory illnesses come. So when we see our kids sick, keeping them at home, avoiding going back to daycare and things like that. And of course, making sure that as parents, we get vaccinated too, to protect those that can't be vaccinated. Masks and vaccines, they tend to work. Doctor, thank you so much for your time. We appreciate it. Thank you. Morning.